this. So we're going to start recording. All right. All right, and like I mentioned, I'm juggling a bunch of windows. This is a new technology for me, so bear with me if it's a little clunky. I stand by the content, but the delivery might be a little odd. So I'm here to talk about taking care of your team. And I'll be helped by Rob, who's going to give some UIHS specific information, and Regina at the end to sort of share some of the specific HR policies and programs around taking care of your team. So first, just as kind of a technology check here, I'm going to launch a poll and see if everyone's able to participate. So can you guys see that? Yeah.
Yes.
So as you answer it, it's sharing with me like the percent of people that are participating. So there's several polls throughout, and I'm going to kind of shoot for at least 50% participation before I share the poll. So the quicker you guys go, the quicker we get through. And by the way, I'm super excited to be presenting this. This sort of idea is very dear to my heart. And if you all are just a fraction of as excited to receive the content as I am to deliver it, we're in a good space today.
It's choice 5, Chris.
I don't know. Like I said, it's going to be clunky.
Okay.
All right, I'm going to end the poll. Let's take a look here. We'll share the results. Can you guys see that? So it looks like some people are choice 5, but for the most part, we're crushing it or feeling pretty good. Very good. If anything looks unusual, let me know, because I can't see what you guys see. So this is all very new. So I'm going to talk more about the philosophical and academic side of taking care of your team. This is going to be more of a general theme. This is going to be the day-to-day taking care of your team. And I'm going to leave it to Regina to speak more to the policies around taking care of your team from an HR standpoint. So I'll be deferring to Regina for HR and for Rob for the UIHS specifics, and also for his experience in what he's done or what has been done at Tribal Public Health. So objectives, we're going to talk briefly about the history of management, different types of work, this concept of execution as learning, the importance of psychological safety, which is a huge topic here, describe how cared for teams operate at peak performance, and then we'll talk about key motivators to keep knowledge workers satisfied. So, why do we even care about taking care of our teams? Other than that, we had a survey from last year that demonstrated, the leadership survey that demonstrated that people don't feel supported here to some degree. So we'll just think about this for a while, and we'll touch on it again later. So I want to talk first about this concept of different types of work. So one type of work is manual work. It's repetitive in nature. It's predictable. It's not particularly creative. It's very left brain dominated. And it's very easy to motivate for punitive measures for poor performance and money or time off or whatever for good performance. So for this, think of the early industrial revolution, assembly lines, factory workers, textile industry, call centers. So this is a type of work where there's a clear set of rules and there's generally a single solution. And this was a time period where many business and management practices originated. This is where punching the clock, the hierarchy, the top telling those below them what to do, holding them accountable, punishing for poor performance. It's really with limited autonomy. You just kind of do what you're told. And this was really made famous by the Ford Motor Company and one of his engineers, Frederick Winslow Taylor. And this style of management is called Taylorism. He wrote this book, which was a big seller in his day. And really, these practices were universally adopted across all industries. So I want to talk about this concept of knowledge work, though. So knowledge work is work where the environment is ever changing. It's unpredictable, requires creativity. It's very right brain dominated, and the motivations are very complex, or the reward system. So this is a type of work where there's multiple solutions, if there's even a solution at all. So more on knowledge work. With knowledge work, generally speaking, people know more about their job than their boss. And give me a thumbs up in the chat if you can relate to this, because I can say that I'm certainly living this. And with knowledge work, it's generally less of a top-down approach, and it's more of leadership coaching workers to help solve problems. And with knowledge work, performance is easily stifled. So again, why do we care about taking care of our teams? And the key is sort of in this slide, and it's this part here that stands out. So because their performance is easily stifled, this is why we need to take care of our teams, among other reasons, but this is a big one. So why we care? Well, taking care of teams are going to perform better. They're going to be more creative, better able to solve problems, sharpen minds, the morale improves, which increases retention, and it's the right thing to do. So I want to show sort of how performance differs between teams and individuals. So a high performing team is going to outperform a group of high performing individuals. However, a low performing team is going to be outperformed by low performing individuals. And the reason is just around the fact that the team environment is going to amplify the good and bad features of the individuals. We've got more moving parts, more opportunity for things to go astray. And for that reason, it's that much more important to take care of our teams. So think about your ideal employee just for a moment. And then I'm going to ask Liz to think about someone other than me. It's a joke, by the way. No one take me too seriously here. But it's important to realize what you consider the ideal employee, because we have to coach to that. We want to foster them, and we want to, in a sense, clone them. So until we can really identify, then there's not much we can do. So I'm going to start with this example here. So this is employee A. Employee A handles any problem with ease. They quietly correct errors. They're even finding other people's errors and correcting them nice and quietly, getting it all done. They're performing flawlessly, and they're deeply dedicated to UIHS. Another poll. So let's see what you guys think of this employee. So if UIHS was full of employee A's, are we going to be exceptionally high performing, or are we going to go through cycles of failure? All right. My goodness. So we're like dead even. Very good. I'm going to convince everybody one way or the other. So now here's employee B. Employee B is not flawless. They're challenging the processes. They're constantly questioning and improving, also deeply dedicated to UIHS. So what are the problems with employee A? Is it that they don't exist? Because they most certainly do. It's that they make it more difficult for the organization as a whole to learn. So if you think about it, employee B is not flawless, but why? Are they pushing the boundaries? Are they trying harder? Are they doing new things? Are they experimenting with processes? These employee Bs are what we would consider the disruptive questioners. They're pushing the envelope. They're identifying issues. They're bringing it to our attention. They're trying to improve. And this is the type of performance that's going to make UIHS improve as a whole. Whereas the employee A's, while excellent to have. They're not bringing to the organization, to leadership's attention, the problem so that we can make improvements. So we really want to coach more for the disruptive questioners, the employee Bs. All right. So now that we more or less have an idea of what we're shooting for the end result with taking care of our teams, let's work to create those employees. So this is real general, just trying to bring it back to the UIHS's vision of a healthy mind, body, and spirit. So to show that we care for the mind, we can offer training, support, appropriate challenges for the body, provide rest, access to care, exercise, and so on. I'm going to touch on this to a large degree later. So we're going to talk more about the byproducts of a well taken care of team before I get into precisely how to take care of your team. So these 4 pillars of success are well documented in the peer-reviewed literature. And these are behaviors that drive success. They're sort of soft measures, but these are the characteristics that define and lead to high-performing teams. Actions that we take as leaders helps to encourage these characteristics and thus increase performance. And you'll find that taking care of your teams fosters these characteristics. So the first one is speaking up. So in a well taken care of team, the team members have the ability to speak up in an honest manner, in a direct manner. They're able to ask questions, able to ask for help, seek feedback, and they're able to discuss errors. So I want you to think, and I can think of many examples, but in your career that you didn't feel safe to speak up, and think about the reasons for this. Was it lack of courage on your part in that moment? Was it a lack of safe space to be able to voice your concerns? And did your inability to speak up in that moment lead to poor outcomes, a delay in needed change? And after the fact, did you think to yourself, I wish I would have spoken up? And this is exactly what we want to avoid here. So also, well taken care of teams are collaborative. So successful teams understand that common goals and work, or they understand the common goals and they work cooperatively towards them. They recognize problems and processes and attack those rather than the people involved with the process and the problems. And they're able to have a mindset of constant process improvement. I told Rebecca that she was going to love my presentation, by the way. It's a very process improvement focus. Another pillar of success is the ability to experiment. So by tentative, I mean here that the kinks aren't fully worked out in the process. They're not agreed, they're not certain, and we're able to do this continuative, iterative process, repeating the steps, making little incremental changes for improvement. And thumbs up if this reminds you of what Simon Says, since we were talking dating ourselves from the, yeah. Lastly, a pillar of team success is reflection. And this is when you take time to think about and reflect on actions and motivations. So we want our teams to question, how did I interact with so-and-so? Was it the right way? How can we improve on this process? And they have to be allowed the time in order to have the time to reflect. So now we've sort of talked about the outputs of having a well taken care of team. And now we're going to start talking about the actual hows to take care of your team. We know more or less what ideal employees are and what behaviors we want. So now we need to work on our side to get this output. And the primary leadership actions of taking care of your team in the day-to-day, we'll talk about these in detail, is framing for learning, improving psychological safety, learning from failure, and spanning boundaries. So before we start talking, I'm curious, who is in the best position to take care of any particular team member? My goodness.
It's not fair that we can only pick one choice.
The single best. All right, you guys crushed it. Sorry, Liz. No love. Nobody thinks you're the most important. So that's absolutely right. The most direct supervisor to any individual is the single most important person by far. So with that knowledge, which you all already had, moving forward, think about your direct reports and how you are going to specifically take care of them within this framework. So the first concept is this concept of framing. And before I talk about it, I'm actually going to frame it because this is my presentation and I can do what I want. So framing is something that happens automatically. And it's where we bring our personal biases into every situation we're in. And this creates a frame through which we interpret everything. We can't stop it. It's happening constantly. And depending on your past experiences and your familiarity with me, you're either thinking I'm crazy or you're curious where I'm going with this. But framing can't stop. But what we can do is reframe anything. And as leaders, specifically the most direct supervisor, you're in a unique position to reframe things for our teams. And I'll give some examples. And actually, I sort of inadvertently performed an example at the beginning when I mentioned how excited I was for this presentation and was hoping that you were all equally excited. This is an example of framing something. So I was framing this presentation for excitement. So this concept
Chris,
of, yes,
Chris, can I add something?
always.
For those of you who read the book that we're going to be talking about, lots of reframing happening in that book and examples, right? So think about that for tomorrow's conversations too.
Yeah, thank you. So those of you that aren't familiar with the concept of a warm handoff, this is, well, I'll describe it and you can see what I mean. So imagine how the experience of a client would be if they personally had a handoff from the front office assistant to the MA to provider to MA to phlebotomist, et cetera, where there was a brief introduction to how great the next team member is, right? This is an example of framing that just makes the client's experience that much more positive. So this is a bad example of framing. It is like nails on a chalkboard when I hear someone at UIHS say something like, well, I'm here, when you ask how their day is. So imagine how this type of speech communicates to your team. That attitude is framing UIHS negatively, as if UIHS isn't the place to be, the place to be working. And there's countless studies within the medical field, and specifically in surgery, that's my particular area of expertise, where new innovations have been rolled out to multiple hospitals and healthcare systems. And they were rolled out in various ways and sort of studied why were some successful and others weren't. And generally speaking, the areas that were successful had leaders that framed this innovation as a learning process, as opposed to just shooting for the end goal. And this is why we'll talk about framing for learning. So more examples of reframing, he's not ready. We can reframe that as, how can we make him ready? We don't have enough resources. Well, how can we use the resources we have? We've done this before, and I hear this one a lot. We've done this before and it didn't work. Okay, well, what aspects did work? I wasn't trained to do this. Well, what can I do to learn and be better at this new job? So the specific leadership actions for framing are framing for learning, which is where we set the tone and get to frame everything at UIHS. And this is vitally important. We don't individually do very much, or I don't feel I do very much, but we do have a responsibility for framing everything that we communicate to our staff about its purpose and how to go about daily business. When we're in a learning mindset, i.e. framed for learning, we're given some slack to make what I consider noble errors. It's a process, it's expected. With this framing for learning, we're given some latitude to ask, to listen and learn. And this is where we can set examples as leadership. So also you want to suspend assumption that one's own perspective is more accurate. As a team, we need to exercise humility ourselves and allow the team to have humility as well. When we do this, our staff, it allows our staff to be more or have more humility also. So we also want to foster teamwork and mutual respect. It does UIHS a major disservice to throw other people or departments under the bus with our framing. Instead, we should frame everything with a sense of teamwork and mutual respect. So the message is really everything's a learning process. We're working to figure things out. We all have a common goal. Give others the benefit of the doubt. Psychological safety. So I personally feel that this is the single most important component of taking care of your teams. And I will have a very brief video and a few slides that will probably better define it than me. But the basic definition is it's a shared belief that the team is safe for interpersonal risk taking. And there are consultants that we can hire just for this. There are books, there are college courses, there are people getting their PhD in this topic alone. And going back to the pillars of success, it's this organizational personality trait that allows people to speak up, share ideas, be engaged, and feel like a valued team member. So the direct benefits, kind of already spoke to it a little bit earlier, but it encourages people to speak up. This alleviates concerns about others' reactions to their ideas. It increases focus. When people are stressed with elevated cortisol levels, they're less able to process information and have creative problem-solving ideas. It supports productive conflict. It allows for disagreement in a way to communicate about it. It mitigates failure. Making errors easier to report allows us the capability to better solve the processes that are causing the errors. Promotes innovation. Again, allows people to suggest new ideas, possibilities that may not arise otherwise. Again, our teams know better. They are the source of ideas. It increases accountability. So this supports people taking the interpersonal risks to pursue higher standards and more challenging goals and tasks. So some bad examples where there was lacks of psychological safety. Everyone knows about the Columbia crash in 2003, I'm assuming, but some of the problems around that crash was as the space shuttle was leaving, there was somebody that thought they saw a piece of ice fall off and knock away one of the pieces of insulation, one of the insulating tiles. They emailed their supervisor. The supervisor didn't feel psychologically safe enough to report this up the chain of command. Ultimately, when the Challenger re-entered the atmosphere, it burned up on re-entry because of that piece of insulation that was missing. Nurses knowing better. So all around the country, when hospitals are doing root cause analysis for medical errors, we find nurses and other staffs that knew better, but were working in an environment where they didn't feel safe to speak up because the physicians didn't provide good psychological safety to allow that feedback. Similar problems in the operating room. Again, think of your own personal examples where you knew something was wrong, but you didn't feel safe to speak up about it. The good. So in pilot culture, it used to be that the co-pilots were evaluated by the pilots, and the relationship was such that it was challenging for the co-pilot to challenge the pilot with questions. The entire industry went through massive retraining to completely get rid of that and create a sense of psychological safety within the cockpit. So prior to becoming a surgeon, I was a nuclear operator in the Navy, so I know a lot about this also. So in the Naval Nuclear Power Program, Everyone is taught to question everything, including authority itself, which is very unusual for a military environment. So in there, any single person can shut down any operation at any time due to their personal safety concerns. No one gets punished due to that person's abundance of caution. And this is because everyone is 100% committed to safety above all else. And if there's some amount of extra work that happens because someone, pulled the strings on something, everyone accepts it. And there's no negative consequences. An operating room. So as an example, when I'm operating, I take a pause during any critical part of the surgery and ask very explicitly that if anyone sees anything or has any concerns for anything I'm doing, voice them. And anyone who's worked with me in the OR has heard me say countless times, if you see something, say something. And all the successful companies around the world allow psychological safety so that they get the most innovation. So imagine at UIHS, if we had a similar culture around one simple goal, like providing access to care. And people felt safe to openly express their concerns and ideas, and all departments rallied around this idea rather than seeing the concerns as more work or inconvenient truths. So these are some barriers that are broken in a psychologically safe environment. So again, allow people to ask questions and be vulnerable, allow people to admit mistakes and ask for help, allow people to provide critical assessments for us of projects, of processes, of directions that we're taking. Don't make people feel like they're disrupting your time. Welcome their feedback. So these are the specific leadership actions for psychological safety. So be accessible and approachable. Makes sense, right? Acknowledge the limits of current knowledge. It's okay to admit you don't know something. Be willing to display fallibility. It's okay to admit that you made a mistake. Invite participation. If you value their input, they will participate more. Highlight failures as learning opportunities. So don't punish well-intentioned mistakes and failures. Make it an example to learn from. But always, again, hold people accountable. Not meeting standards, mistakes not well-intentioned, need to be held accountable consistently and fairly. So some questions just to consider when determining if it's psychologically safe or not. Is a mistake held against you? Can you mention tough issues? Are people rejected for differing ideas? Is it difficult to ask for help? Do members act to undermine? Are unique talents valued and utilized? All right. So this is, if you look this lady up, she is a rock star. She's got so many books and papers. Let me see if this video will play. I'm gonna make it work.
One of the most important factors in delivering safe and effective care is psychological safety. Allow me to define that as a belief that the workplace is safe for speaking up with ideas, questions, concerns, and even mistakes. And it's a sense of confidence that your voice is valued. You can think of this as a sense of permission for candor, that the workplace is somewhere where we count on your voice being heard, because you never know when you will have had the observation that someone else missed that will be mission critical to delivering safe, high quality care. Now, I want to be clear that psychological safety is not about being nice. It's not about holding back on something you think might be unpleasant. In fact, quite the opposite. It's about candor. It's also, of course, not freedom from conflict. When you're in a psychologically safe workplace, there will be conflict. People will have different points of view, and we'll get into it, and we'll seek to understand each other's views better and come out with a better solution. Psychological safety and a psychologically safe workplace doesn't mean that all of your ideas will be applauded.
No, I wasn't able to increase the volume. Hope everyone can hear that okay.
And it's certainly not permission to slack off. It's not a license to whine. It's not oversharing. We still want people to be thoughtful and considerate in sharing work relevant content. And important to mention, psychological safety isn't the goal. Psychological safety is a means to the goal, and that goal is excellence. That goal is commitment to high quality care. So it's important to recognize that for really high quality care, you need not just psychological safety, you also need urgency and commitment to excellence. If you don't have either psychological safety or a commitment to excellence, then you are working what I call the apathy zone, where your heart isn't in it, you don't much like your colleagues, and you're just not giving the work what you could give it. And certainly if all you had was psychological safety and no commitment to excellence, then you'd be in what we call the comfort zone, where it's quite a relaxed state of affairs. I know that that's not characterizing care delivery today. However, this is the one that worries me. When your commitment to excellence and your sense of urgency are high, but psychological safety is low, I call that the interpersonal anxiety zone, where your commitment to excellence is thwarted by not feeling that your voice is welcome. So finally, if you have both psychological safety and a commitment to excellence, that's the learning zone, that's the high performance zone. That's where problems get solved day in and day out, especially in healthcare delivery.
All right, sorry for those accidental pauses. So this is what she was speaking to. So if you look on the y-axis, psychological safety, X accountability, and you can sort of visualize this. If you're held to high standards and kept accountable, meanwhile, you're not in a psychologically safe environment, you're working in this anxiety-ridden zone where, as you can imagine, we have high turnover, low retention. So we're really shooting for this, holding people to high standards, but allowing them the opportunity to speak their voice, psychological safety, better learning, better performance. Another poll, let's see here. So be honest here, this is 100% anonymous. There's no way for anyone to know what you answered here. This is just for our own edification.
This might be interesting.
Right?
I hope other parts were.
I didn't mean it like that.
I'm going to wait for a few more. There we go. All right, let's share it. Let's analyze it. So it's interesting, and I guess in hindsight, this sort of makes sense. We think that UIHS as a whole is sort of low performing in psychological safety. We're looking at 64% are rarely to sometimes. But if we look at each individual, boy, we're crushing it. So there's a disconnect there for sure. And this speaks to our own biases, that we intrinsically think that we're doing things right and others aren't.
You think
Can you scroll it down a little bit? We can't see the bottom.
that
Oh, really? Oh, no.
If you just scroll.
You
can
can
scroll
scroll
You can
on your
scroll
own
it
on your own
yourself.
screen.
I,
Liz.
oh,
You can
okay.
scroll on your own.
Phew. Interesting. Someone take a screenshot of that.
But you have to scroll down. We
I,
can only see number 1 and number 2.
Liz, I think you're able to scroll yourself.
Yeah.
you can scroll yourself.
Yeah, you can do it yourself, that you don't need Chris to do it.
Thank you for your help.
What a psychologically safe
I
environment.
feel very, yeah, and a little humbled.
You
I
notice
think
she
this
said a
was a
little.
setup.
She said a little. Humble.
How much humble pie do you want?
Yeah. All right, I'm gonna stop sharing. That's good. That's good data though. That's useful for something.
It looks like some of us might be in a box.
Yeah, someone's reading. All right. So learning from failure or learning from failure. So if you ever really taken the time to internalize what failure is and what it means, is it bad or does it need reframed? So think about the levels of blameworthiness or praiseworthiness on this scale here for types of failure. So if we look at deviance, deviance is the person chose to violate prescribed processes or practices. Is this blameworthy or praiseworthy? Obviously blameworthy. Error of inattention, they inadvertently deviated. Again, that's blameworthy. Lack of ability, the person doesn't process or possess the skills, conditions, or training. So now who's at fault? Is it us for hiring, us for not providing proper training? We're starting to already get into a scale that's less blame about the person, more blame on the process or us. Process inadequacy, again, the person's competent, but the process is flawed or inadequate. Hard to blame that person. You guys can read on yourself. My point in this slide is that when things go wrong, when there is a failure, it's not always the individual's personal fault for it. We really need to consider why the failure occurred before we take action. So the leadership actions specifically surrounding learning from failure. So embrace the messenger. This often can be the erroneous person, hopefully in a psychologically safe environment. And that takes courage to be the messenger. So embrace them. Gather information and ask for feedback prior to taking action. You're probably going to reach barriers in trying to get more information, especially if you have to get information from other people that don't feel psychologically safe to share that. Reward failure detection. The name of the game is rewarding good behavior. The earlier we can detect errors, mistakes, process breakdowns, the quicker we can improve. You really want to shoot for multiple small failures that we're catching, improving, rather than the small failures going unseen, leading to one large failure. Encourage interdisciplinary teams. So this maximizes the diversity and spread of learning. It allows it to trickle into other departments in our case. And like I spoke about, ensure the blameworthiness prior to punishment. And this kind of goes without saying, but when we're trying to foster psychological safety while also improving processes, we need to be careful about when we dish out some form of punishment. Span boundaries. So spanning boundaries is more about taking care of other people's teams at UIHS and understand that we're all implicitly thinking that our group has it different. And I think this kind of goes back to that last poll that we did, that everyone thinks that their group has it harder, is doing more, is more important, et cetera. And this our group concept, it can be by occupation, by department, level of schooling. It really doesn't matter. We're social animals, and we're automatically creating these boundaries in our minds and categorizing people as part of the group or not part of the group. And in our minds, we're part of countless groups, and how this plays out just sort of depends on the situation. The most important boundary in my mind at UIHS is our identity to our departmental boundaries. So who doesn't think that their department isn't the most dedicated, hardest working, most overlooked, underappreciated department? So the point of this concept is to recognize your own personal biases, as well as the fact that everyone else is working with the same biases, even though their biases might directly oppose yours. So the direct actions related to spanning boundaries is celebrate diversity. Like my current signature says, none of us is as smart as all of us, the more diverse the group is that's brought into the conversation, the smarter the collective we is. Deliberately span boundaries. And this isn't natural. It's not natural for us to reach out to other groups that we don't currently identify as being part of. So this is also an example of reframing, where we're not framed to talk about just our departments, but the organization as a whole.
Everybody has to be players in that.
Create alternative collective groups, kind of like I talked about. So for example, you're not just in fiscal, you're not just in medical, you're UIHS. Encourage interdisciplinary collaboration. Kind of spoke about that already. So here we are. We talked about the output that we're shooting for. We talked about this sort of framework that leadership can lay down. And now we're going to talk about the specific motivations for knowledge work. So I'm just going to circle back real quick on manual labor and how it differs from what we're doing. And I should point out that our manual work is different from manual labor. Manual labor, like the facility guys are doing, is highly creative and requires flexibility. So for definitions here, it's different than manual work. So in a manual work environment, this is the old school management style, like I was speaking of. This is an execution as efficiency model. The leader has the answer and they tell everyone what to do, and that's how things are. It's generally stable processes. Any change is huge. There's one-way feedback where leadership provides feedback down, nothing coming back. Judgment, especially going up the chain, is discouraged, and fear of the boss is a completely normal part of this. So this is obviously not what we want. We're shooting for an execution as learning style, where leaders set a direction and everyone else sort of works together to aim in that direction because other people know better. There's constant little changes. There's two-way feedback in both directions. Judgment's essential. And again, we want to avoid fear because it inhibits experimentation, analysis, and proper problem solving. So how do we take care of our knowledge workers, or how do we motivate them? Again, it's this complex reward system that we spoke about like about 3 hours ago, I think. So the three real key motivators to knowledge work are purpose, mastery, and autonomy. And when I say motivation, it's also related to job satisfaction, which is taking care of our teams. So they all want their jobs to be meaningful, and they want to have purpose. They want to be good at their jobs, and they want to have the authority to do their jobs. So along with psychological safety, this is the real key to taking care of our team on a day-to-day basis. So we really want to make sure that our team's firing on all three of these. And if they're not, figuring out why and what we can do. And maybe they just don't see that they have one of them. So ensuring purpose. So this one's interesting to me here, because this is one of the hardest aspects to foster at an organization. And by an organization, I mean not UIHS. Imagine working at Widgets Incorporated, where you don't even particularly like the widgets you're making. You know, good luck convincing those people that there's purpose, there's meaning in their work. We, on the other hand, are collectively providing care for people that were at one point marginalized, subjected to genocide, had their land stolen, etc., preaching to the choir. And now we are providing a space for them to obtain equitable care in an organization that's literally their own. So purpose is very easy for us to communicate at UIHS. I'm not a native, but this whole concept to me is very powerful. And I can only imagine the courage of the founders to go, you know, we're not getting the care and the attention we deserve as people as the original stewards of this land, we're tired of the broken promises. We're not going to play in your system anymore. And they went out and they created UIHS 60 some years ago. And we get to work here and be part of this legacy. So I personally feel this is awesome. And I think everyone at UIHS should feel a powerful sense of purpose. And if they don't, then it's our fault as leadership for not communicating that to them. So ensuring mastery. Nobody wants to feel like they're being tossed into doing something unprepared and unsupported. Maybe one, not the other on a temporary basis, but not both. So I like the adage of give a man a fish and you feed him for a day, teach a man to fish and you feed him for a lifetime. So to me, it's important to have a solid onboarding process. Like everything else, the process should be constantly questioned, reevaluated, asking new people what was helpful, what was not helpful, asking them 3 to 6 months later, what do you wish you would have been taught during onboarding to make this helpful for you now? And to me, this isn't an HR process. This is something that every department should be doing internally, or at least every department that hires people. So when people are good at their jobs, they feel empowered and they just feel better. When they're good at their job, it makes the job less emotionally taxing. They're able to teach others. It creates a feed-forward effect of learning and teaching. Evaluations, when done properly, offer feedback where the recipient maybe didn't even know they had an area for improvement. So opportunities for learning, we can be curating training opportunities, having training built into the schedule. And really, it's this system of support are the boots on the ground supervisors caring for their team by providing training support, evaluating, finding weak areas, not just at an individual level, but across departments for larger training opportunities. Autonomy. So let me just say that not everyone wants autonomy. Almost everyone wants to have a degree of independence and freedom from being micromanaged, but there's certainly a subset that do want to be micromanaged. So this one's a little careful, but for ensuring autonomy, we need to build trust. We have to have mutual trust. Obviously, you need to have trust in the person that you're providing the autonomy to, but they have to have trust that you're going to support them along the way and give them some leeway during this learning process. We do need to have clear boundaries to allow them to work within and grow the barriers or grow the constraints of the barriers over time. So grant ownership, telling everyone explicitly something like, this is on you, this is your project. If you don't do this, nobody else is going to, does a lot to empower ownership. Learning by mistakes, covered this earlier in detail. And support. So I end almost all my asks with something to the tune of, if you reach some sort of barrier, please let me know. And let them know that your job is to help them do their job. Ooh, another question. I should have allowed multiple choice, maybe. The level of participation is dropping off as the presentation goes on. Can you guys see that? So pretty even across the board. Kind of surprised to see that No, I guess that makes sense. All right, well, that 30% that thinks that their team is lacking purpose, boy, we should be able to curve that, I would think. The other two are a little trickier.
Chris, can I make a comment real quick?
Always, please.
I didn't see anything on here that I could answer with. That's not to say there may not be things, but I mean, I don't feel like there was something. You said participation dropped off. Well, maybe people felt like these weren't the things that were, I don't know, maybe they already feel motivated. I don't know.
Gotcha.
But
Yeah,
anyway,
yeah.
I just want to point out that, well, you might not have felt like you could fit into any box there. So,
Yeah, no, point taken. Yeah, maybe a none of the above might even work. Thank you. All right. So now we are here. We have talked about the leadership activities or leadership actions to sort of set the stage for these outputs, this high performance, as well as how specifically to make our knowledge workers satisfied. So now I'm going to ask Regina to talk specifically, if you can, Regina. If not, I'll talk for you, for some of the specific programs at UIHS from an
Sure.
HR standpoint.
You can, talk about anything as well, no problem. So I just listed some of the things that we have available to us through Cigna, our provider. And we had life assistance program through Cigna last year, and now we've increased the offerings and benefits for our employees, and it's now the Employee Assistance Program, EAP, which many of you are probably familiar with. But go back to that last slide real quick, 1 second, Chris. So these, this is some of the total wellness is some of the things that are available online to handle with stress, your nutrition and exercise, sleep, things like that. So just to help you, there's lots of things online, tons of things to help with work-life balance, which I'm working on. Okay, next page. And then here's the EAP program. We've increased the sessions to 6 sessions with a face-to-face counselor, no cost to the employee. They're face-to-face or virtual. And this is for each subject matter. So one might be about stress. The next one might be about relationships, maybe work issues, things like that. So you get 6 sessions for each subject matter. And this is for you and anybody living in your household. They don't have to be a family member. It's just anyone living in your household. And then you have confidential phone consultations. They're available 24 hours, 7 days a week to handle issues that you're having possibly. And all of this is totally confidential, a total separate entity from United Indian Health Services and available to you. So they have assistance with referrals to the different communities resources that we have around, senior care, child care, pet care, financial and legal assistance. Somebody was telling me, one of our supervisors here was telling me that she looked into the financial services referrals. She wanted to increase her credit. And she said it was so great. The guy was so great and it was very successful. So she got a 30-minute financial consultation. He ran her credit scores, things like that, and showed her where she needed to improve and what she needed to do. And she's working on that. And she was just very impressed by that. You also have identity theft. These are things that are stressful, that are on your mind and just wearing on you. So 60-minute consult for the prevention of identity theft, or if you're victimized by identity theft, that's available to you. Legal consulting, free 30-minute consult with an attorney. And then you get 25% off if you needed more time than the 30 minutes. So I would do all my prep work ahead of time. Like if you want to prepare a will, maybe just do everything ahead of time, and then you can just use that 30 minutes in a better way. So support for your mind and body. There's national wellness seminars. You could take part in monthly seminars that they have available. They have live seminars or on demand. There's lots and lots available. And these are something that you can help your staff with too, if they're having issues, because we aren't licensed consultants, and we need to really point them in this direction so that you aren't getting too, the boundaries. You have to keep those boundaries, and you aren't getting too involved in their issues. Behavioral awareness series, monthly behavioral awareness seminars on all these various topics: eating disorders, substance abuse, children's behavior, and things like that. Suicide awareness and prevention is there as well. Crisis resources and just information, managing stress toolkit to access mindfulness exercises and discover stress management techniques. You can go here as well. And any questions or support that you need, the phone numbers there and the websites there. We've ordered many brochures, and they have a little cutout card for your wallet. So those will be coming soon, and we'll be promoting this and handing them out to everyone. Our benefits, we got some very rich benefits: health coverage, company paid for employees, preventative care, no cost. We've added massage therapy along with the chiropractic care and the acupuncture that's available to you. It's only, I believe it's a $35 copay is all you're going to pay for these visits that you have. The massage therapy, I have to point out that one, you must be referred by a licensed provider, that one. There is a membership discount at the club, health and fitness. I tried to find out exactly what that was, and I couldn't get that, but there is a membership if you want a membership discount if you want to look into that. And we've got company paid life insurance, accidental death and dismemberment as well. So if something were to happen to you, you lost your life, your beneficiary would get one time your annual salary. And if it was an accident on top of losing your life, they would get 2 times your annual salary. So that's all paid for you by the company. If you were to get into an accident and you lost a finger or a leg or a foot or something, then that would be paid to you. The benefit would be paid to you, of course, because you didn't lose your life. And then we've got long-term disability available to us as well, and that's company paid. Retirement plan, a company match up to 4%. Bereavement leave, up to 5 paid days, full pay of bereavement leave. Holidays, paid time off for the holidays. There's 11 of those. Personal leave, 16 to 26 days of paid time off, depending on how long you've been with the company. There's a Life Mart through ADP, which has discounts in travel, grocery, childcare that you can look into as well. And 200 hours of paid training, 10% of your time. Did you want to speak to that?
Yeah, I
Chris?
just added that in
Yeah,
there.
that one. Go ahead.
I mean, we have 200 hours of paid training, which essentially amounts to 10% of your time. So 1/2 day per week. In addition, sort of some new things that are either on the way, potentially on the way, or here in the short term are monies for departments to do retreats. We're looking into having at-work massages, having a more vibrant opportunities for training, staff engagement with Yammer. That's dependent on our Microsoft 365 rollout, a mentoring program. We're considering 410s, weekend work, and more flexible scheduling. So
there's
just,
constantly lots of things coming up, right, Chris?
yeah.
We had the wellness program going for a little while. With the gentleman that came in at lunchtime to help you out there. There's going to be lots of things coming. So, and any suggestions are welcomed, of course. Pretty exciting times, sure. Thanks, Chris.
Sure. So this is just a quick summary of the leadership actions. This is just cut and paste from previous slides. The summary. So we work in a knowledge work environment. I don't think the importance of psychological safety in the work environment can be overstressed. I think we now understand that everything is a learning process, and keeping your team satisfied by ensuring autonomy, mastery, and purpose. Here's references for the curious minds. And I'll be sharing this presentation with everyone as well via email later. That's all I have. Any questions?
So I think at the end of this here, I'll just go ahead and share a little bit from Tribal Public Health and what we've done as a division. And I see a black screen. Is there a way to get back to our gallery?
Yeah, let me stop sharing.
All right, so thank you for that presentation, and thank you for some of the technical aspects of support that we have, Regina. And really looking at the 4 pillars as far as speaking up and collaborative and the experimentation and reflection. One of the things that we've done at Tribal Public Health as a division is to have quarterly meetings. And this is a way to celebrate our staff success, to welcome our staff members to our division. You know, just something consistently throughout the year. So every 3 months. In addition to that, some of the things that we have done as well through Tribal Public Health is to have our managers and supervisors meet every other week to check in on our programs, to see how we could collaborate with each other. And again, just to you know, broaden our knowledge base within our own division. And of course, that trickles down to our departments and sometimes even our individual projects. And I think that really enhances as far as those pillars that Chris talked about earlier. And I know that we have many folks here in Tribal Public Health as far as managers and supervisors, and you know, feel free to speak up as well. And of course, since we're UIHS, some of the things that we like to do is to survey, right? And so some of the things that we've done with our staff in the past is to actually ask them as far as how to inspire, acknowledge, and how we want to communicate with one another. So in looking at some of these in the past that we've asked, and we actually measured this to actually see where we're at, just as Chris did those polls, and we're like, wow, that's like really important information, and maybe we need to screenshot this, as that we really have something tangible to move forward. Because sometimes we do have our own bias, like we're doing everything well, but maybe some, you know, within the organization we're not. So some of the questions that we've asked within our own division is, in the past, I feel more inspired to meet my goals at work. And like, what response do we have? And then again, to give us a baseline to move forward, to improve that, whatever data that we get back, and to have this come up at other quarterly meetings as well. Other questions that we've asked: in the past month, I feel appreciated for the work that I do. Other questions: how could Tribal Public Health leadership do to inspire and make you feel more appreciated for the work that you do? So an open-ended question for us managers and supervisors. Again, getting that feedback from our own staff. And I think it's always important to get, you know, your own internal data, right? To actually hear from our staff members as well. And we have that collected as well. Some of the things that we just generally want to know as a division: I feel I am informed about Tribal Public Health events and activities. What could Tribal Public Health leadership do to make you feel more informed about Tribal Public Health events and activities? And again, collecting this and see where we could continuously improve. We even asked them questions regarding COVID-19 impacting our families, our work, and our community, and how can we at Tribal Public Health leadership do to support you during these times? And some of those things that we heard was some flexibility, making sure that our staff are safe, even having time off were some of the responses that we got back when we're asking that question. And so that's really important too when we think about the UIHS COVID leave as well. So I just think it's really important to get that information from our staff. Some of the things that we heard too is that to be acknowledged in a more timely manner, for exceptional work that they do. So some of the things that we've done is to give gift cards, like you went, above and beyond, and here's like this little coffee card. And just some of those things. And if others in Tribal Public Health want to add anything to how we support our staff, feel free to jump in.
Amanda's got her hand up.
I didn't see that.
Yeah, well, I was just going to second what you said about that. I've literally sat in meetings and heard Alyssa many times over say at the very end, like, how can I help you? How can I be better? And take the feedback right there on the fly from somebody. And then by the next meeting, she's already doing it. So I've seen it in action and it works really well. And I can tell that people feel really supported by that. And so anyone else in public health, I had a couple things just about the presentation though that I wanted to mention. I thought, Chris, I just want to thank you for just even the statement you said of like, I'm not Native, and then kind of went into something. And it was just really cool because you went into talking about UIHS and the founders of UIHS. And you said founders, and typically like growing up in school, you say someone says founders and they mean like of the United States. But when you said founders, you were actually talking about UIHS, and it took me a minute to realize that that's what you did, and you did it so seamlessly. And I just want to like thank you for that. And I felt honored by that, and I honor you for just kind of incorporating that in your language. That was really cool. I'm like emotional about it actually. I can feel it in my voice. So another thing that I took a note on was about the psychological safety and taking risks, and it reminded me of Gona. And how just as tribal people and Native culture that when we come around and we really support each other, that we talk about taking healthy risks. And we say, take a healthy risk when we encourage people to talk. And so just kind of bringing that back to this is who we are as people, to be able to have these environments that are encouraging for people to take their risks. And then the last thing I had was about this is another culture thing, but growing up, when you have elders in the room or someone who is more proficient or a little bit more advanced, or just any elder, you typically don't talk until they're done. And so sometimes I've sat in meetings or I've been in college classes where I'm just like letting everybody talk, and like I'll listen to everybody else because it's ingrained in me to not necessarily speak up. And so I just wanted to kind of put that out there for people who are managing or supervising other people that maybe grew up with that as a paradigm, that sometimes you do have to kind of wait for the quiet ones because they might be out of respect, not talking until everybody's finished, that they like have honor and respect for in the room. So I think that's it.
Great points, Amanda. I wanted to make a couple of points too. Chris, can you bring up your slide with employee A and employee B? And I want to talk a little bit about employee A and employee B, because employee A, they're so easy to manage and supervise, right? They're the yes people. They're the ones that always do what you ask them to do. And so they seem to make your life easy. But the question is, do they make you better? Think about that. Do they make you better? Do they make our services better for our clients? Do they make processes easier for each other? Right? Probably not, right? They probably don't. It's the employee B that's going to make you better, right? They're the ones going to ask you, and they should do it respectfully. And I want to bring up that some people might not know how to do that respectfully. And so that might be our job to say, can you say that in a different way, right? can you sit, because I want to hear what you're saying, but I need you to say it in a different way. Okay. Sometimes people bring up situations that they really disagree with when they're very emotional. And what does that mean when they're very emotional? That means they're deeply dedicated, right? And so they feel passionate. And sometimes that's hard to take information from them. And so that might be a time as supervisors that we have to step back and say, I see that you feel really, really, really emotional. I see that you feel very passionate about this, but let's step back for a minute so that you can voice that in a respectful way, right? Those employees are going to make you better, right? They're going to make the systems change. And we know there's lots of systems. We have some old systems that need to change, but they're the ones that are going to be pointing it out. So really remember to appreciate those Bs, even though the As are easier, right? The Bs are the ones that are going to make us better. What questions do you have? What feedback do you have? Wake up. Go ahead, Kathy B.
Oh, I was just laughing, just because you said, speak up. But I actually think that we need a mix of, or somehow we need to meld employee A and B together, because I agree with what you said and what Chris said, but I feel like if employee B isn't doing their job, and they're constantly complaining, we're going to have a bigger problem on our hand.
True. So I really liked the piece where Chris talks about there still has to be accountability, right? So just because someone is saying, you know, they're just saying, complaining about everything, right? A couple of things that a lot of leaders institute is that if you come to me with a problem, I need for you to also come to me with a solution. Right? You can't just be a complainer. And maybe they don't have a solution, but they come with open mind of who can we go to for solutions, right? So we can't just have people who are just complaining about everything. And the other piece is that, you know, the combination of A and B are unicorns. That's what a lot of leaders call them, as unicorns. They're hard to find, right? They're hard to find. So don't expect that from people. We have to kind of meet people where they are and coach them, right? So that they can be more of a combination. Terry?
Being of probably employee B minus category, I would like to say one thing about the deeply dedicated to UIHS. I would like to think about reframing that a little bit and I think that's implied, but deeply dedicated to our patients and the people we serve. Because I have to tell you, there have been times when I didn't feel very dedicated to the organization based on its overall behavior, but I never stopped feeling the dedication to the community I served. I don't feel like that today after listening to this, but there have been times. And so I just would, you know, keep that little morsel in the back of our minds that's what being dedicated to this place means, is being dedicated to the people we serve.
That is something that Valerie Reed has said, is sometimes what's best for the clients isn't always best for UHS. Right. Sometimes that is true. Cecil.
My thoughts here is that employee A and employee B may be more outright, you know, they speak up. Employee A, the mixture is a definite responsibility on the management. You need to understand both employees. You need to understand how they work and how they work together. You can get as much out of an employee A as you get B if you probe and if you have an understanding of them. So I really feel like a lot of this accountability on ideal employees comes down to the person that's managing the department. And Again, it's like the inverted pyramid that we talked a little about, Liz. Our clients are our employees. And they're dealing with, the ground level people, but we've got to be, plugged into them and know them well enough to make both of these employees work. And my answer wasn't B, it was more A, if you have a relationship.
I like that concept of, giving employee A, probing them a little bit. It might also lead to what Amanda was talking about too, is that some people are just going to work hard and not say a whole lot, but they got a lot to say if you ask them.
Exactly. Right. Yep.
Kathy B.
What came to mind about one of the differences between employee A and employee B, and maybe the success of either, in my limited experience, is sometimes people they're told to do something and they do it. They don't know why they're doing it. They just do it. Their boss told them to do it. So that kind of sounds to me like it's an employee A kind of response. They do it, they perform it flawlessly. But when there's a breakdown and something didn't work flawlessly for them, it like completely stops the process immediately right there. But if you teach that employee why they're doing it, they're more capable of then coming up with a solution, a workaround to get it done. So why, for me, is a huge, huge thing that we need to make sure that we instill in our employees.
Those are good points, Kathy. And the other thing I want to add to the conversation is that employee A and leading an employee A, where you're just telling them what to do and they just do what you say, that's very old school. Right? That's very old school. That's how we used to manage. When I used to read books about management, that was what they would say, in the 80s and 90s. And it's different now. The next generation, they want to know the why, right? And the other thing to remember is the number one reason why people leave a job is because of their supervisor. And all those things that Chris had laid out in the presentation, thank you, Chris, that was such a good presentation. That's a list of why people leave. And those are things that can be changed. We can make that change in ourselves. Some of us do it without even knowing. But I would encourage everyone to go back to this presentation and take a look at it. I tried to make notes and we went on before I could totally write down a lot of the information. It was so good. Lots of gems in there, you guys. But remember, we are trying to be better for our staff. And because when our staff feels taken care of, they take care of our clients better. Right? Right.
One of the things, of course, I recognize, that especially in my role, is to take care of my managers and my supervisors, so.
This is Valerie. So you asked Rob earlier about other things about tribal public health.
Mm-hmm.
And years back when we started our strategic plan within our department, within tribal public health, I went to Liz and asked her, what are we doing? What is our plan? Where are we headed? How do we improve? How do we get better? So it's when we grounded ourselves to come up with a plan that we could do and change every year. But we grounded ourselves and became a better team, a solid team in getting things done, accomplishing things, bringing people along with us, mentoring, and all of those things by having that strategic plan just internally for ourselves, thinking of ways to expand skill and knowledge base, our team players, making employee A, employee B, and knowing that there's employee C through Z as well, but it takes everybody to create a team. So I just want to add that.
Thanks, Val. Ray, you had your hand up.
Yeah, I just wanted to kind of echo what Kathy had said on employee A. It struck me that if they're rigid, then it's obviously not a good thing. But if they're flexible, or you could get them to be flexible, then it's okay to have some employees like A. And with the B employees, as long as they're actually getting the job done, then this is a really great set of features. I like when my staff ask me questions about what we're doing or why we're doing it. Obviously, if they understand why we're doing something, you're going to get that buy-in, and they should be more dedicated and put more effort into it. That's all.
Buy-in is a new word that's been used, and absolutely, buy-in is important that we get that from our staff. Chris, did you have anything to close up? I'm sorry, I kind of took over your presentation.
No, that worked out perfectly. Yeah, I appreciate everybody's feedback. I think we had a great discussion at the end that sort of solidified some of the concepts. This was great.
Bill has his hand up.
I just had a question. Sorry, about follow-up to this. I've done some advanced trainings before where they break it down into 4 employee groups. So I think Val mentioned it, A, B, C, and D. And there's advantages to having your team, whether it be a team of managers or a team of employees, having all those different qualities. Because if you have just all A's, like we discussed earlier, that's not necessarily a good thing for feedback. So is there more trainings in the works that could really delve into how, or the advantages and how to utilize people that are different in your team?
Well, we hadn't planned on it, but we certainly can put something together, right, Chris?
Certainly can.
Thank you for offering, Chris. That was awesome.
I know.
I just got voluntold.
You did a great job.
You did. You know what they say in Indian way is they ask you to do something because you're good at it. And that's your, that's your like, if you're like an elder asks you to do something, which I am your elder, you do it because they think you're good at it. And I always joke, people don't ask me to cook.
Please don't ever ask her to cook.
Tani?
Yeah, I just had a quick question. We had mentioned like, I guess incentives or some sort of a gift, something to acknowledge our staff. Is there any kind of budget for that or cap on that, or how do we go about proceeding with that? Like the coffee card that Rob had brought up.
Thank you so much for asking. So what we want you to do, and I didn't mention this, but we want all of you to do is think about what is it that you would like to do? Go back, talk with your, there's more than one manager, supervisor in your department. And what do you want to do? Do you want to have, we did in tribal public health, we did $10 coffee cards. We did $25 lunch cards. We did actual gifts, but not much more than $50 a piece for bigger kinds of incentives, or to kind of, really appreciate our staff. One time we had so many good people, we said, we put you into a drawing and then you could win. But budget that in your 22-23 budget, right? The other thing we would like each of you to do is to try to have at least one day or one half day a year with your staff to do some bonding and planning activities. Behavioral health is doing that right now. They're planning for their next year and budget for that. Now, one of the things in terms of what the cap is going to be is bigger departments will get a little bit more money, right? Smaller departments will get less money. So I'm thinking about like combining administration with compliance because we have small departments, but together we could do something. So think about, what that would look like. Tribal Public Health will be doing theirs together. They've been doing one time a year. They go to the beach and we share a meal, and then, we do some bonding activities there and getting to know each other. And now that's going to be a little bit harder in medical. And so Chris is taking into consideration how are we going to do that. Half the staff may have to, they might not be able to do it together. They might have to do 50-50 for a half a day. But we're trying to figure out how we can least impact services. But doing it once a year, I don't think is a lot. but I think it's something where you all can, you know, get to know each other, and where we get a chance to show appreciation for our staff and the great work that they're doing. Thank you for that question. Any closing remarks? All right, you guys, I guess this was great. I can't wait to see it on YouTube because I want to watch it again. Thank you so much, everyone.